Hello and good evening, everyone. Thanks so much for being here. My name is Mary Garrison, and I will be the moderator for this evening's event. I'm a professor of social work at Millikin University and a licensed clinical social worker with a lot of years in practice, education, and training in the behavioral health arena. I serve as a board member on Kennedy Forum, Illinois, as well as on the advisory board of the Farm Family Resource Initiative. We're really excited this evening to engage in this really essential discussion as we round out May is Mental Health Awareness Month and focusing on rural health in mental health in rural America and how we can improve access and eliminate barriers to essential mental health care. We have a really wonderful set of panelists this evening, very distinguished speakers that will assist in this discussion. And so let me do some quick introductions, and then we'll go ahead and get started. I first want to introduce Karen Stallman. Karen is the Agricultural Resource Specialist for the Farm Family Resource Initiative, managed by SIU School of Medicine Center for Rural Health and Social Service Development. Welcome, Karen. Thanks for being here. Next, we have Liz Hulsizer. Liz is a fifth-generation corn and soybean farmer with her husband, Matt. Liz works as a grain originator for a large grain company immersed in agriculture and engages in talking with farmers daily. Liz, thanks for being here. Next, we have Dr. Courtney Cuthbertson, is an assistant professor and extension specialist in human development and family studies at University of Illinois. Courtney, thank you so much for joining us this evening. And last to join us is Jeff Franklin. Jeff is the director of SIU School of Medicine Center for Rural Health and Social Service Development and has many years of professional experience with a special interest in the areas of coordinated school health education, bullying prevention, social and emotional learning, and youth development. So as you can see, we've got a lot of great experience here this evening, and we're going to take the next hour to really dive into talking about mental health in rural America. So again, thank you all for being here. So Liz, I'm going to get started with you. And I would like to ask you several things, if I may. So as a fifth generation farmer, can you share your personal perspective of how important it is to focus on mental health in rural areas? And in particular, what different barriers and challenges that farmers may face related to mental health?
Sure, Mary. So the two main barriers that I see in rural America, especially with farmers, is accessibility and acceptability. Mm-hmm. We need to have more accessibility for our farmers, and how far of a drive it might take, how many resources there are for them to get their hands wrapped around, to get them in person. And then also the other barrier is acceptable. And we're trying to break that stigma down. It's been a long road for everyone across the country. It doesn't have to do just with rural America. But I do believe that rural America, farmers in particular, are a little bit slower to breaking down that stigma. And so we're just trying to get it where that stigma is broken and there's more of an acceptability to asking for help, seeking help, and getting help.
And you hit right on kind of my next question for you was related to stigma. And so we know that there's stigma related to mental health, right? And access to services and people seeking services. So we are fighting that nationwide. But again, you in particular said that for rural America and farmers, why is the stigma a little bit different potentially for them?
So there's several reasons for the stigma. Typically, we're the farmers, it's a male-dominated environment. That doesn't mean there aren't female people out there in the agriculture industry making a difference, but it is a male-dominated sector. And then also on top of that, it is a very proud American dream sector. And so I think that with us, we're a very proud group of individuals. And we are a tight-knit community. And I think that sometimes in a male-dominated industry, they can see seeking help as being a weakness. It's not, but I believe that's kind of where they go. And also, you just don't want to admit that you have a problem. You want to be that shining star on the side of the road, showing that you're your farm is successful. And so to show any type of weakness in their mind is what's part of the barrier.
I would imagine there's a lot of pressure as well, just of, right, keeping that, like, you're a 5th generation farmer, right, keeping that farm going and not wanting, like you said, to kind of admit that maybe you need some support. In your experiences, have you seen individuals, farmers say, yes, I need help? And then how did their friends and family respond to that?
So yes, as a 5th generation farmer, and most farms are multi-generation. There are 1st generation farms, and they are not immune to this by any means. But as a 5th, 4th, 6th, whatever generation farmer you are, you have that extra weight on your shoulders that the prior generations before you have been successful and passed the farm on to the next generation. And so when it comes to you, you're sitting here saying, it's been in the family for 100 and some years. How can I be the reason it fails? And so that just puts this extra weight on you. I have been personally affected by people not seeking help, and it has not turned out well. And I have also been affected by my own family. My husband in particular, he has been honest with people and said, you know what, I need help. I need to seek counseling, or I need to see a doctor, or I need to talk to people. And in the community of farming, it just, in anything, anytime there's a crisis or anything, they scoop everybody up, they take them in, and they help them. And so really, when you do start opening up, it is such a positive experience that it's like, why did we ever once think that for a moment we would feel shame? And so it's been very positive when those people do open up. And we have noticed that through us opening up about our experiences, more and more people, it's like a domino effect, have started to open up as well.
You've made it safe for individuals and offered that support. So, Liz, thank you for sharing that you've had some, personal experience with this. And I do think it is about using our voice, right? And sharing that, and that, we can move forward. So thank you so much. So Courtney, I'm going to step over to you, and I have 2 questions, essentially. So what are new and emerging concerns that impact farm stress? And second, what is unique about rural communities or farming that we see disparities in mental health? So Liz has kind of started that conversation. Can you take it a little further?
Absolutely. I think these are great questions. And first, just to really appreciate the opportunity to be a part of the panel this evening. I think first to mention what the disparities look like. In the US population, we see that about 8% experience depression in a given year. And when we look at agricultural populations, that can range from 9 all the way to 53%. Anxiety is impacting about 19% of the US population in general, but when we look at those in agriculture, we see percentages that are more like 33 all the way up to 71% who are impacted by anxiety. And then when we look at things like suicide rates that are measured per 100,000 people, among the US population, the suicide rate is at about 14 per 100,000. And when we look at that broken down, it's a little over 22 per 100,000 for males, 6 per 100,000 for females. When we look at the statistics among people in agricultural populations, we only have a reliable number for male farmers, which is 36.1 per 100,000. So if you've been taking note of those numbers, the rate of suicide among male farmers is over 2.5 times that of the general population, and over 1.5 times that of males in the general population. This is a higher rate than what we see among veterans. So the differences are certainly very concerning. Liz has outlined some of the stressors already, and research as well as lived experience has well documented several types of stressors for people in agriculture, which include financial things related to fluctuating input prices or costs, fluctuating commodity prices, availability of loans, what interest rates look like, taxes, trade policy, healthcare costs are another financial concern. Having enough cash on hand to deal with emergencies or things that might come up that are unexpected. There are also stressors around managing the well-being of the farm, whether that is related to animal health and dealing with disease and pests, or crop health and dealing with pests and disease, having sufficient staffing on the farm, and then also family involvement in work. That's one way that agriculture is very different than other types of industries. There's the stressors related to navigating different types of acute weather events. Several of us right now are under thunderstorm watches and tornado watches, and those have really big impacts when it comes to agriculture as well. Things about the work environment can be very stressful, long hours and high workloads. When we're talking about new and emerging concerns, there are a couple that come to mind that I would say fit within those that I've mentioned already, that maybe are what's new and emerging is the specificity of some of these. So there have been concerns this spring related to avian flu, and it seems like those concerns are lessening a bit as researchers that are tracking avian flu have found it is impacting backyard flocks more than it is impacting production agriculture. But in response to seeing that avian flu was increasing, there have been organizations offering different kinds of programs and information about biosecurity on farms and how to take proper measures to protect poultry and different flocks that producers are working with, what to do. And it can increase stress on top of those stresses that one already experiences. Another concern that has emerged over the spring is around the situation in Ukraine, because Ukraine is a major producer of wheat. So that will impact global supply chains and food supplies, and the conflict has impacted input costs and commodity prices as well. So those are the new and emerging concerns that I see and have heard about. And I do think that it's not necessarily a new concern, but one that I think people are talking more about is related exactly to the reason we came together today to talk about mental health and mental health care access. So I think Liz has done a good job outlining some of those barriers already. And in addition to affordability and acceptability, I hear a lot of concerns around whether healthcare providers understand what it's like to work in agriculture, and whether the kinds of recommendations that producers might get feel like they are relevant, appropriate, and fitting for what it means to work in agriculture.
And, I think about, Courtney, all you covered is there's so much there, and so much that's out of the control, right, of the farmer. And as you just talked about the weather, we were chatting about a little bit earlier this evening, and you can't control that. I have a good friend who's a farmer, and gets frustrated because things are put off, right, and the rain's coming or not enough rain, those kinds of things. And that has to be really stressful again, and the pressure that comes and when you have to respond.
Right. It's a big challenge that so many of those stressors are things that are outside of any one person's control. Some additional things that I think make, in particular, that are unique among those who work in agriculture, also relates to some of the identity things that Liz mentioned around not wanting to feel like you're letting down your family legacy. Feeling a sense of connection to your family, to the land where you're working, to animals, and a sense of responsibility and obligation. A phrase that I hear quite often is about how, as producers, they may feel responsible for feeding the world, and that is a thing that is seen as very humbling and gratifying to be able to do, but also feels like a weight or a pressure. This is something I want to be able to contribute to, and the stressors can compound with that. There's also some unique aspects of agriculture related to isolation, and people working in a more isolated setting where they're alone with their thoughts a lot more than folks in other kinds of work settings. So there are many other aspects that we can talk about as we continue tonight.
And I really am glad that you brought that up, because I think that unless you work in agriculture, you maybe don't understand that isolation. And the other piece that when Liz was speaking and you were speaking that I thought of is just the use of the supports that you have within that unique community, right? So instead of maybe seeking help from a professional, using those supports within, and I, as a professional myself, I know that I can't just go into a rural community and expect here I'm going to open my office and everybody's just going to come and everybody's going to be fine. And so really creating those relationships are needed, right? And to understand, as you said, what it means to be in agriculture and all that you've both just discussed. So thanks for getting us started on those really, really important areas. And so all of this that we're talking about this evening has been around for a long time, right? All these stressors, we're finally putting a highlight on this and making it a voice. And one of the things I want to do next is I want to bring Karen into the conversation so she can share about the Farm Family Resource Initiative and who all of us on this panel are a part of. And that's why we're together here. But Karen, could you go ahead and speak to that a little bit?
Yes, thank you, Mary, and I appreciate being a part of the panel this evening. So I'm coming to you from the farm that we live and work on in Randolph County, and it would have been nice to be able to take my laptop to the window and show you a beautiful farm field in the background. But as you just heard from Dr. Cuthbertson, the weather can certainly cause some increase in anxiety. And so if I were looking out the window right now, I'd be seeing a lot of wet fields, soybeans that are just emerging, which should be up pretty well by now, and more rain coming down. So all of that adds to our farm stress. So let me talk a little bit about the Farm Family Resource Initiative. Senator Scott Bennett is the senator in the 52nd Senate District, and he had deep roots in agriculture. And in 2019, he identified the need to be doing something for our Illinois farm families that would relate to farm stress and how we can help families here in Illinois. And so he introduced legislation for the Farm Family Resource Initiative. So I helped coordinate that with the SIU School of Medicine Center for Rural Health and Social Service Development. And we began by piloting in 6 central Illinois counties. We did a needs assessment, we created a website, we did a lot of activity in those 6 pilot counties and learned a lot. Since that time, we have been able to expand statewide. So thanks to the leadership of our Illinois Department of Agriculture Director Jerry Costello, we were able to secure some USDA funds to also help with our efforts. And last September, we were able to go statewide. So now we're in all of the counties. So our overarching goal of the Farm Family Resource Initiative is really to improve the quality of lives for Illinois farm families. And that means both physically and mentally. So we have identified some objectives, including identifying farm family needs, including mental health needs, compiling resources, sharing resources, creating new resources for farmers, and developing a network of partners, both professional and otherwise, to address these needs. So yes, Mary, everyone here is on our FFRI Advisory Council. So we have an advisory council that meets monthly, and that's made up of ag industry, ag business, education professionals, as you might expect, Illinois Farm Bureau, Farm Credit, University of Illinois Extension, and also some farmers. So Liz and Matt are on the advisory council, along with a couple other producers. And we rely on the advisory council to provide guidance for us, to provide support, to make recommendations, and also to carry out our efforts. So I can't express enough thanks to each of you for serving on the advisory council and for the work you do to support us. So let me mention that the website, our website is siumed.org/farm. And I tell folks, if that seems like a lot, just Google Farm Family Resource Initiative. We've got the website up on the screen now. Just Google Farm Family Resource Initiative, and you'll find a lot of resources. So we list resources. We've done many webinars. We've done some professional development, and we have those links on the website. We do a monthly blog. You can learn about our Nurse Scholar program for rural healthcare professionals. You can learn about mental health first aid, which is something that we teach. We have some online modules there again for rural healthcare professionals. Dr. Cuthbertson was just talking about healthcare and access to healthcare, and we targeted some online modules to help those professionals that are treating people in the rural areas. So that website is packed with a lot of information. I'll also highlight what we kind of think of as our centerpiece, and that's our Farm Family Resource Initiative Helpline. And we established a year ago 24/7 confidential helpline. 1-833-FARM-SOS is the number. And that helpline is manned by Memorial Behavioral Health in Springfield, their call center, and it's a designated line. You can call in at any time. I tell folks I could be planting corn on Friday night and at midnight decide I just have to have somebody to talk to, and I could call that helpline. And this, because of the funding, we've been able to add a text line and also an email option. So you can also text the number. You can also email if you feel more comfortable doing that. Another thing that we've added because of the additional funding is that now we can offer some telehealth counseling sessions. So through our SIU School of Medicine, through our counselors, callers, if they're interested in some follow-up, can receive up to 6 counseling sessions at no charge via telehealth. So I could access that there again over my mobile device, over my computer. And we've heard a lot about stigma. So my truck is parked at the local counseling service, but I can access those counseling sessions over telehealth.
And that is just a range of options that to make sure that there is that access for farmers is really important, obviously, any time of the day and in various versions of that. I know in my short time on the advisory council, just the amount of awareness and work that's occurred has been tremendous. And so clearly has a lot of momentum, and the people who are at the table, again, and I think farmers that are at the table that know this, right? And being able to help drive what's happening and use the resources is incredible. So I always feel like in Illinois, I'm fighting for anything past I-80, down, and because a lot of stuff, right, originates out of the Chicago area. And, we need to think about that in our rural counties. And there was just a report that came out that really showed how disadvantaged rural, in Illinois in particular, rural areas are for mental health. It's significantly different than up north by the Chicago area. There's problems with our system all over the state, right? But in terms of the access, that availability, it's a really problematic, and that really needs to change. And I think the Farm Family Resource Initiative has proven that they're making strides in that. And I know we got some billboards up, right, Karen, and that we have.
Getting close. We just met yesterday about billboards. So yes, you will be seeing those in different locations in the state.
Good. Wonder. I know we were picking areas where we thought they'd be visible by folks. So wonderful. Karen, thanks for your leadership in that area.
Thank you.
Jeff, I want to now chat with you a little bit. Can you discuss with us issues around equity and social determinants of health and what that can look like in rural areas?
Yes, thank you, Mary, and thanks for inviting me to be a part of this conversation today. We've heard a lot already from the panelists of some of those social determinants that are barriers to equity for us, and I think when we look at a rural area and how we best want to address or come up with strategies to improve equity. It's very complex. I think it's layered, if you will, looking at need. We're already, in rural areas, have disadvantaged and under-resourced communities. We see access issues that we heard, and lower life expectancy, higher rates of chronic disease. People are not always engaging in the most positive health behaviors, and we see that in rural areas. But then, as we start to look at the need at a deeper level, and things that we need to take into consideration, let's think about the experienced disparities and the need of minority or marginalized or vulnerable populations in rural, and maybe those aren't always being looked at or considered. And then think about where we're located. For us, we're in the Mississippi Delta region, and we know that in the South and some of those other areas, where life expectancy may be lower in rural, if you sit in like the Delta region, life expectancy is even lower for rural. So I think it just becomes an effort to overcome all of that need. As I think about mental health issues and stigma, and having worked in a rural area my whole life, we do hear some of those issues around transportation. Reliable transportation, or getting access. It's not local. You have to travel so far, and then maybe there's the rural cultural competence piece that even if there is public transportation available, well, that could be a 9 or 10 hour day, for to go somewhere for an appointment. But we see that there's this idea that no, our family needs to drive us. Our family needs to take us. We don't need to use public transportation, and or there's a lack of insurance, or insurance that doesn't cover mental health services. And as we look at some of the social, like the infrastructure side of things, so what we're hearing from our communities when we're assessing need and trying to determine unmet needs, that our communities say we want to see a more localized delivery of services and resources. Okay, that overcomes some of the barriers. Well, we can take a mobile unit to an area and equip it with telehealth, which is fantastic, but there's connectivity issues. So maybe that's not not the best way to overcome, or there's just a lot to consider. But Liz, I really appreciate what you were saying about stigma. Being in a rural area, having taught school and have seen some of that stigma, and that we're not really looking necessarily at like a whole school, whole community, whole child model, where we're looking at physical health and the social emotional health as something that's really important. So thinking about strategies, really starting to look at anti-stigma campaigns, looking at, and you got to this, telling your story, breaking down that barrier by saying, I needed help, and and that was okay. Karen mentioned mental health first aid. If we have issues around access, let's look at building the capacity of the people in our community. And programs like mental health first aid, that is something where we can work on capacity building and teach people to recognize when someone might be in crisis, and give them language and tools, to help that person. But really starting to have those conversations, looking at a model like the community health worker model, or certified recovery support specialist, taking somebody from the community that's known, that has relationships, lived experience, is trusted, let that person be in a role that's helping connect dots. Because what I think we know about rural is that success of anything in rural is relationships is foundational to success in rural, and taking the time to build those trusted relationships, and part of building that relationship, I think, is really getting to know your community and getting to know it really well. Not just collecting and analyzing data and trying to look at unmet needs, but going back to that those marginalized or those minority or vulnerable populations, looking at the historical context that shaped the experiences for them, or and the health of the residents of communities. And then as you start to see the need that's or a barrier, you've built these relationships, and that then becomes the time where you can leverage those resources and relationships, to come together as a community to start addressing some of those needs, and hopefully getting to equity, because isn't that what we all value? Ultimate, the best health that someone can have.
Absolutely. And just everything you said really resonated with me, but that relationship piece, Jeff, and to create that takes time, right? And our system doesn't always allow for that time. And then, but also being present in that community. So providers that are invested in that community and are seen there and at shopping and eating and at the places that people are, I think is really an important piece. And, you mentioned several things that are great examples. Like you said, we could do a telehealth, we can get access, but there's always another layer, right? Like you said, the access, then there's not, there's connectivity issues. Your mental health services aren't necessarily covered by, the insurance, if you have that. So we can say we've got answers for these things, but we're not digging deep enough, I think, to really understand what transportation looks like, what that telehealth might look like there. And I think that's the work that we need to be doing.
Mm-hmm. And sometimes it's not selling it, but letting people know that we're going to improve health, and all of the we're going to improve chronic disease, we're going to health literacy, and yes, we're going to do it by focusing on transportation or the economic side or the workforce side of things, and looking at a shortage, or looking at a well-prepared, well-trained workforce, and what does that look like, and how do we bring community members in to serve in some of these roles that we're identifying that our workforce needs.
Absolutely. And right, in thinking about again, I was just thinking about coming into rural communities and what we can do to make a difference. So we know we need to do this work, and you're all doing this great work. But how do we get more support? How do we bring this in? And we have some really amazing people on the advisory council, but how do we get more money to be able to provide and address these issues and to make that difference? What's the job of all of us on this webinar tonight that we need to be doing? And Jeff, I guess I could start with you, but anybody could respond. What more could we be doing to get our message out that we need more help and support and money and, if you will, funding?
I think as we get to know our communities more and really looking at what those needs are and looking for those trends and those threads, but finding other organizations or other groups like our advisory council,
Mhm.
you know, that see that. And to me, it becomes a common language,
Mhm.
you know, around what that need is. And, you know, when we have that, I think it's, then it becomes the right time to seek funding and to see, you know, see what's out there. You know, I think as we work with communities and address some of these issues, that as we're building these relationships, that the communities feel that we're there to work with them and not do something to them.
Mhm.
You know, I think that takes us, you know, a long way, and that we look at how do we build the capacity of a community, you know, if we're thinking about sustainability, and how do we transfer that capacity to that community. And, you know, as we look at that, then I think it becomes an easier sell to me, because it's a collaboration, it's a voice, it's a path, it's a value that we're all moving toward.
Mhm.
Mary, I might chime in that I think the more we have these opportunities to share what we're doing, in the last day and a half, I presented to hospital CEOs with the Illinois Critical Access Hospital Network. I did a presentation for the Illinois corn growers. I did a couple radio interviews. I think the more that we share, and when now we're more face to face with some of those presentations, I could see yesterday and got feedback from those hospital CEOs. It was just like a light bulb going off.
Mm-hmm.
Like, wow, we are so glad you are doing this. That there is such a need for this. And here's a whole laundry list of things you could be doing. So I think it's opportunities like this to spread the news, to increase awareness, and let others know what we're doing, and that we're doing things that actually benefit them, that they see some value. When I talked to the hospital yesterday, those CEOs, I talked to them about the Nurse Scholar program, the online modules, looking at where we're providing continuing medical education credits. All of those things are beneficial for them. So I think a large part of it is getting the word out and letting people know what resources are available. That to me is how you get a lot of buy-in.
Right, and seeing how those partnerships and collaborations really benefit everybody, right?
Right.
In the end. Mm-hmm.
Right. And of course, being responsive.
Absolutely. You know, I know for part of my curriculum, and I teach about mental health services and teach some of the clinical skills. You know, I've brought in rural aspects of rural, because that we need to understand that, and that's something that I've been doing for the last several years, so that my students that are going out into practice, or, you know, going on, have an understanding that this is an area of need, and they can go get jobs there, and then they can also have that competence that's needed, maybe differently from some of their peers. So,
You know, and I think sometimes, you know, if we think about a school system, you know, and sometimes the schools and our faith communities are, you know, those central points in a lot of communities. And if a school, you know, takes time and really looks at creating this culture of wellness, of, you know, health and wellness, both physical and the social and emotional side, you know, I think that goes, you know, then we just extend the learning, you know, it moves into the community, for family, and then into the community. And well, I forgot where I was going with that one, but there's just so much that can happen, you know, and, you know, even looking at, you know, and understanding and telling the story that we're taking some time to become trauma informed, that we're understanding the impact of of trauma, and we're moving past, you know, some of this maybe issues around stigma where we say, you know, what's wrong with you to what happened to you. And, you know, and understanding that can help move, you know, the needle forward as well.
Absolutely. And I think that language, you know, words matter, how we talk to individuals, how we talk about mental health and awareness. And again, if we share our experiences, but it does, it's not, we don't want to be blaming. We want to ask how we can support and help, and really normalize that we all have, that people are impacted, their mental health is impacted. And clearly across our country, there are millions of individuals who live with, you know, mental health diagnoses and are getting help, but are not. So I find it challenging, right? Because I think in the larger system, we still have a lot of people who aren't getting care. And then when you look at particular areas like you talked about, Jeff, there's even larger numbers of people who are not getting care, and who are impacted by those social determinants. And so that equity isn't existing.
I mean, there's so many areas that we could explore. You know, we talk about food insecurity and food deserts, and, you know, access to healthy foods and the impacts, you know, that all of that has. And, you know, that for a lot of us, Dollar General is where we grocery shop, you know, and, you know, all of the, you know, impacts of a lot of those issues.
And if I could chime in just a second, Mary, one of the other things I think that we need to be doing to bring more awareness to this is it starts with the accessibility. And when we talk about the accessibility, and right now it could take us up to an hour to drive somewhere to find a certified medical professional. And then just like trying on shoes, trying medicine, sometimes they're not the right fit. And so you're going to go through several professionals until you find the right fit of who's going to work for you and work with you. And so if you have an hour drive and then an hour there and an hour back, there's 3 hours out of your day. When you include the seasonality of what farmers are going through and how sometimes everything in their life stops except planting or harvest season, it really puts a time constraint on what they're able to do. And so if we could encourage from the top down to all the medical professionals that are coming out into the field, encouraging them to seek out opportunities in the rural areas, not just the urban areas, and finding ways to encourage people to make a home in the rural areas, and having more accessibility to certified professionals, that would come such a long way in making a strive in a leap towards the what we're aiming for. So while we need to be sharing our stories and getting our information out there, we also need to be bringing certified professionals to us. And that starts at the education level and at the funding level, hoping for scholarships and things to encourage people to come back to the rural part of the state.
Right.
Very well said. And part of that could also be, you know, looking at loan repayment programs, you know, for someone who will choose to work in a rural area or stay in a rural area, because hopefully we're growing our own, and, you know, they're coming back and serving their home, you know, in their neighborhood.
Absolutely.
I think the panelists who have shared so far have made absolutely great recommendations, and I really appreciate the kinds of incentives that might help people to work as medical providers or healthcare providers in rural settings, what might help keep people in rural settings, as well as the idea of building up that community capacity. So you may be tuning in today and thinking, well, I don't work in this area. This is something I care about. I'm not really sure, like, what even would I do? I think another aspect we could consider is, what are the perspectives that we each hold, or the frameworks that we think about mental health with? Because a lot of times I find that people hear mental health and what they think of is mental illness. And when we think about mental health, we can consider this not as you have a mental illness or you don't have a mental illness, but mental health is a spectrum that goes all the way from poor mental health to excellent mental health, similar to the way that physical health would. So the question is not, is this person in need of support, but what is the support that would help this person no matter where along that spectrum they might be? So in doing that kind of frame shift around what mental health is, it is maybe easier to see or to hear that we all need support. We all have mental health all the time. And it's not weird or shameful that we use different supports. We use different resources to help us with wherever we might be. So I think one thing that's really helpful in moving forward is considering the perspectives that we use to think about mental health, and everyone is included in this. Anyone who's tuning in, whether you work in mental health or not, whether you work in a rural community or not, what is the way that you think about what mental health is? I think even as someone who's not, say, a healthcare provider, anyone can make a difference by checking in with someone and saying, hey, how are you doing? Noticing when someone is seeming maybe a little more stressed, or just highlighting the importance of those relationships. And some of the things they talk about in those mental health first aid classes around, what do you know about this person in the way that they act or speak, in the way that they are typically, and is their behavior different than it usually is? That's a good sign that it's time to check in. Maybe a little extra, and just text that person, call them, go check in with them in person if it's possible, ask how they're doing, and start conversations around these topics. And if you hear me say that and say, I don't know how to do that, you can say, I went to this great panel. The Kennedy Forum held this excellent panel, and I thought it was really interesting. I'd love your thoughts on it. Can I tell you about it? Use this panel as your reason to start that conversation. It can be uncomfortable at first if it's something that you don't have as much practice in, but it is a discomfort that is well worth sitting through to be able to have those conversations, because you never know the impact you can make just by starting the conversation. And doing things like that also helps to reduce the stigma, so that more people feel like, oh, I can start this conversation with someone else. So the kinds of ripple effects we never really know the full impact of. So in addition to things like, let's absolutely ramp up services and think about how we can improve access in rural communities and build up community capacity, we can start by thinking about how we can have conversations with other people around these topics as well.
That's such a good point, Courtney, and to reframe that. And, so to me, when I think about mental health, it's are you, being socially aware, being self-aware, and, and I also think that, if we reframe and we talk about self-care and those things that we need to do for ourselves, there's also, I think, a role for collaborative care. Where do we come together? Where do we have those conversations? How do we work together to show care? And you're totally right, totally addressing stigma and breaking down some barriers.
And I think when those conversations begin, although it may be awkward for some folks, most of the response, and if not all, is going to be, oh my gosh, thank you. I think it's rare to have anybody negatively respond. They kind of want you to ask, right? They want you to have the conversation. And so I think that-that's really important. And I appreciate that you brought that up, Courtney.
Sorry, Mary, just to piggyback on what Courtney said, the big key hot word right now in agriculture is sustainability. And that means so many things on sustainability, on sustaining your farm, sustaining to where you can farm again, being socially and environmentally conscious. And that's how we all are. We are all constantly thinking about being sustainable. We now have shifted from plastic straws to paper straws. And if we put that much effort into constantly being aware of being environmentally sustainable, we also need to be mentally sustainable. And our farm, your house, your household, it is nothing without you as the person, and our farm is nothing without the farmer. And so sustainability also needs to be that constant in your thought process of, okay, I'm constantly making an effort to recycle this can. I also need to be consciously making an effort to keep myself sustainable. And so when you kind of think of it that way and realize that sustainability means more than just the farm, the planet, your neighborhood, and you think about it as yourself, I think that can start to shift that direction too. Like Courtney said, where we have people checking in with people and being more socially aware of what's going on.
Liz, thank you. That was wonderful. Really great point. We have a couple comments from the YouTube, and it says that accessibility also includes being able to afford a certified professional, right? So that, can we afford that? Do I have insurance? How does all that work? So very, very important as well. And then also working collaboratively with faith-based communities to establish relationships and rapport within these communities. And so, as we talked about, going back, Jeff, to talking about relationships, right? And those partnerships and collaboration, that faith community, also really important as well. And I know as a practitioner, being comfortable that those are the people that I would work with, right? Those are my colleagues, and those are the supports. It's not just one person coming in, it's utilizing that whole community to support. I think is a really, really important part. So Courtney, you had asked if you could share a little bit about some of the activities and resources through the North Central Farm and Ranch Stress Assistance Center. You want to take a few moments to do that as we start to wind down here in our last 10 minutes?
Sure, absolutely. Thanks for the opportunity to share about this. So the North Central Farm and Ranch Stress Assistance Center is a project that is funded through USDA and the Institute for Food and Agriculture. It is one of 4 regional centers across the United States that have the purpose of providing stress assistance and stress reduction resources to agricultural community members, including people who are producers, farm workers, work on farms, or people who are in supportive roles or agriculturally relevant roles. So that could include things like loan officers or veterinarians, mechanics and seed dealers. So this, the North Central region includes 12 Midwestern states, and we work collaboratively. I lead this effort with my colleague, Dr. Josie Rudolphi, here at the University of Illinois. There are 5 major activities that are a part of this. One includes a telephone helpline through Iowa Concern that's run by Iowa State University, but that is open for people across the region. There is a clearinghouse website of resources that is at farmstress.org. There are mental health literacy education programs like Mental Health First Aid, and there are some farm stress and agriculture specific trainings related to mental health that were developed by Michigan State University Extension, one called Communicating with Farmers Under Stress and another called Weathering the Storm. So those are offered through our efforts. There are also some collaborators who are offering support groups for people in agriculture as an opportunity to get together and talk about what's going on, learn more about managing stress. And those have been quite successful to date. They have some support groups that have happened with migrant farm workers who are Spanish speaking, have had the impact of decreasing a sense of isolation, improving connectedness, decreasing alcohol consumption, and decreasing depressive symptoms. So those social connections can be really, really powerful. This effort also includes connections to behavioral health services. And I would say a strength of this effort, in addition to the efforts with the Farm Family Resource Initiative, are the ways that we can get so much more done, so many more resources out, so much more information out by working together across sectors, across organizations, because we do share this goal. We want for people who are in agricultural communities to be well and to thrive. So what are the things that we can do to contribute to reducing stress and increasing access to those things that can be helpful? So the North Central Farm and Ranch Stress Assistance Center website, again, is at farmstress.org. And if people have more questions, I'm happy to take emails or questions. So thanks again for letting me share.
Absolutely, Courtney. Thank you. Wonderful resources and activities that are going on. And, I think we've heard tonight about a lot of things happening, right, in Illinois and across our country. And we need to keep supporting those and developing those. So as we wind down, we have just about 5 minutes. I wanted to leave it open for any kind of last words from panelists, as we've had this great discussion this evening. Is there anything you'd like to in particular leave the audience with?
I would
guess-
say, go ahead, Karen.
Oh, just real quickly, I would just say if you want to learn more about Farm Family Resource Initiative, check out the website or contact information. We have people available to do trainings, to do professional development, come out and do presentations. So I tell people, keep us on your radar if there's something we can do to assist you.
Great. Thanks, Karen. Courtney?
Thank you. I was just going to reiterate the message that there are multiple ways to be involved that can be more formal and can be more informal, but everyone can make a difference. And I just wanted to say thank you to everyone who is watching right now, because you're here and watching because you care, and this is something that feels important to you. Thank you for caring about this, and tell people about this panel, have conversations.
Absolutely. And just so everyone knows that we are recording this panel, and it will be available on the Kennedy Forum website as a YouTube show. So again, sending people to that website and you going there and sharing that as our audience. So I think this is valuable and could help support all the great work that's happening. So
it's so nice to see, everyone come together with a common why. Why do we do what we're doing, and what motivates us? And I think I would also encourage, as we look at health priorities in our communities, some may say, well, it's cardiovascular disease, or, it's diabetes. Think about social determinants of health as a health priority in and of itself, and right along with everything else, and so that there is a very intentional effort to look at those social determinants that are impacting our communities and strategize around it.
And I think for me, just the biggest takeaway, just like Courtney has said before, just those of you that are on here, you're showing that this is important, and also just knowing that we all can truly make a difference. And I know that sounds so cliche, but truly you can. And just being that person and showing up and saying, how are you? Or I'm here to listen, or something's not right, let's get some help. Any of those things is monumental in what we're trying to do. Whether we're farmers, rural America, urban America, we are all just humans trying to make it in this world, and life is tough. And so just to show up and be in someone's life and ask them and take an interest in how they are doing is so important. I can't stress it enough. And you really can make a difference. And it doesn't matter if you're a certified professional or not. Just taking that time to be kind. At the end of the day, it's just about being kind. And I just appreciate all of you that have been on here, because it proves to me that whether we're urban or rural, it matters no matter who we are, because we're all human.
thank you. What a great ending note, Liz. Thank you. Courtney, thank you. Jeff, thank you. Karen, thank you for really great discussion this evening, and starting this conversation right here and continuing it. And so I'm going to challenge our audience that they do continue that conversation and have talk about those words matter. So thank you, everyone, for your support. Again, please get on the Farm Family Resource Initiative website, Kennedy Forum website, for more resources. And we're going to close out on that. Thank you very much, everyone, and have a good evening.